working. So the connection. Oh, here he is. Hello, Jan.
Good afternoon, Niels.
Good to see you.
Good to see you too.
Jan, we have received a lot of questions from our visitors concerning the immune system to boost on my phone. Then it seems that I'm stopping this conference, but now I'm back online. So my first question from our followers is, what has the greatest influence on our immune system? Is there any specific, or is it the combination of different factors?
Well, of course, in the whole body, it's never one problem, one greatest influence. It's more the combination of different minerals, vitamins, and behaviors. So I think the summary of healthy behavior, the summary of healthy minerals and vitamins is important for immune system. But if you have one specific lack, the whole system is involved. So you can't say this is the one and only reason or the most important reason. So you have to have a look on the whole system. And you have to try to live healthy and to eat healthy and proper food, so that you don't develop a specific lack in one system.
Okay, maybe then I can just follow up with my second question we have received, which is especially for food. Is there food which are beneficial for our immune system?
Well, of course, there are several foods which are beneficial, especially.
Let's start with the fruits. Let's start with fruits. Would you recommend a specific kind of fruit?
Well, I would recommend specific kind of fruits. So for example, citrus fruits, well, everybody knows that these kind of fruits are rich of vitamin C, which is known as to be the most important vitamin and the vitamins in the immune system. So especially popular fruits, grapefruit, oranges, lemons, limes, clementines, or whatever. So they are rich in vitamin C, and they can help, of course, to boost the level of vitamin C upwards. So you have to know that other animals, for example, like pigs, they could produce vitamin C on its own. So when they have a viral infection or bacterial infection, they can increase the vitamin C level by 1,000-fold or even higher. So, but the human beings, they have lost the enzyme to produce vitamin C on their own. So that's the reason why they need to eat citrus fruits, for example, or also some other fruits like papaya, or kiwi, which are also rich on vitamin C.
Which I find quite surprising. When we had last time our conversation about this subject, you also mentioned that also some vegetables have even more vitamin C than
yes,
fruits.
Exactly. For example, the red bell peppers, so they have even more vitamin C than the citrus fruits. But you have to be careful how you eat it. So if you have it's fresh in the salad, they of course they have a lot of vitamin C. But if you cook it, so then you lose. The longer you cook the vegetables, the lower the vitamin C level is in most of the vegetables. So, but also broccoli, for example, broccoli is known to be one of the superchargers of vitamin C, but also vitamin A, E, and also a lot of antioxidants and fibers. So, well, once again, it's not only one single thing what you should eat. It's also important to have a variety of different foodstuffs, because if you eat only fruits, for example, then of course you will miss some other minerals which are also as important as the vitamin C in the citrus fruits.
Okay. What about spices? I also learned that some spices are very beneficial.
Well, of course, we know, for example, for a long time that garlic has healthy benefits on the immune system, but also on the cardiovascular system. So this, of course, is known for years that it helps in infections and so on. It's also ginger or turmeric have healthy effects on the efficiency of the immune system and can stimulate immune response to viruses and bacteria.
We just had a question here in between. What about frozen foods? Because you said already that especially vegetables, when they are cooked, that they are losing some vitamins. What about frozen fruits or frozen vegetables?
Well, of course, if you compare old, fresh vegetables from supermarket, for example, when it was there for 2 or 3 days, the amount of vitamins goes down. So if you compare this kind of fresh, so-called fresh fruit of vegetables with the frozen one, it's far better to have the frozen ones, because the frozen ones, you get it from the ground and then you freeze it immediately. And that means that the loss in vitamins is only small. So if you have unprocessed fresh vegetables and unprocessed fresh fruits, it's really healthy.
Mm-hmm. When we probably don't have the opportunity, or maybe we don't like to eat so many vegetables, fruits, and this named spices, we also can use for sure some supplements. Is there some specific supplements which you would say are the most important one for boosting the immune system?
Well, of course, especially in the situation with coronavirus infections, I think the vitamin C is really important. So I suggest my clients always to have vitamin C as capsules at home. So when they feel the first symptoms of viral infections like coughing or whatever, so then I suggest them to start with 1 gram of vitamin C and to continue with 500 grams, so 1 capsule in the morning and the evening. And if you start early, and it means early, so the first symptoms you should start. So you should not go to the pharmacy to buy the vitamin C then. So if you start early, most of the viral infection can be controlled with vitamin C boost. Or you can also ask for vitamin C infusion, for example, in the Arts Club or in the Lanserhof department. Okay. So that's the basic. So, but also, of course, we have some other vitamins which sometimes are a problem, especially in the older ones. So vitamin B complex, for example, so which is the combination of different B vitamins, especially B6, B12, and folic acid, which is known to be that especially when you have a stressful life and you become older, that you have problems with the absorption. And also they are important for the immune system, because they are important for the production of lymphoid cells, and also of the vitality of the lymphoid cells. So that's the reason why B vitamins is also important, and also D vitamins. So sunlight is really important to boost your immune system, so to produce a lot of D vitamin. And maybe at this time especially, it's good to be on the supplementation. I myself, I'm also on the supplementation of C, B, and D at the moment, and also in the minerals, zinc may be good. But you can also consume shellfish or something like this, which is known to or mussels, which are known to have a lot of zinc.
Yeah, for me, this is one of the biggest surprises of this crisis, to be honest, because I wasn't aware that vitamin D is so important for the immune system. But you can hear it really everywhere, and especially when you are not allowed to go out, or when sometimes it's not allowed, sometimes it is just recommended not to go out. Then it's pretty hard to produce any vitamin D by yourself. So I think to use supplements is probably the only way to get the right doses of vitamin D.
Well, especially in vitamin D, you may be right, but also apart from this crisis, in the north, in the northern countries, we all have problems with sunlight. So that means most of us, they have a lack in vitamin D. So that's really common to have a lack in that. So, well, I'm in vitamin D, the only way is to take supplements. Of course, in vitamin C, vitamin B, and zinc, you can also eat healthy, but at the moment, I just want to be prevented on a specific lack in these vitamins, and especially in the B vitamins and C vitamins also. Both of them, they're well tolerated and you can't overdose it. So, well, almost overdose it. You can't overdose it. So in zinc, you have to be a little bit more careful. So I would not take more than the suggested dosage of zinc at the moment, because this may be poisoning. But the other vitamins, in most of the cases, they are tolerated well.
What I really like on vitamin D is it is not, I don't know whether this is available in every country, but in Germany, we have this 20,000 milligram vitamin D doses, which is enough for 1 week. And so that you just have to take it 1 week. So you don't have this like vitamin C, which you have to take every day. So it is much more comfortable to make a kind of ritual out of it. So we have it, for example, in our family, everybody getting his vitamin D doses for breakfast on Sundays. And so we are.
But you have to be careful, because the vitamin D is only absorbed well when you eat oily products beside
which I do for breakfast.
Perfect. So then it's okay. But if you just have a low-fat breakfast, then you will have problems also with the absorption.
No, on Sundays, I can promise you I don't have a low-fat breakfast.
Okay, so then it's okay.
There are some preparations which are also saying that they are boosting the immune system, for example, echinacea or cistus. Do you have meaning on these kind of immune boosting products?
So, well, we're using both of them. So because as these herbs are known to stimulate the immune system, but we only have data in influenza viruses. So we know that the time of the disease is shortened by these well-known substances. We don't know how it will boost or how it will interfere with the coronaviruses, because especially the echinacea and cistus, they interfere with a specific part of the infection of the influenza virus, and as this part is not involved in the corona infection, it may not be effective in the coronavirus infection. However, both of the substances, they have also other effects than on the specific influenza infection. So maybe they help, but we don't know it at the moment. Okay. And of course, I would never treat a coronavirus infection with, well, maybe as an additional therapy, but the rest has to be treated like school medicine therapies at the moment. And especially you have to be careful when you get symptoms like shortness of breath or whatever. And when this starts, you should ask a physician immediately.
So I can tell you, I have a little bottle of echinacea liquids at home, and I was drinking it every morning. It is really disgusting, to be honest. I really don't like the taste. And well, unfortunately,
cistus tastes well. So
cistus is not so bad. Cistus is even better.
But this is really great. Yeah.
But I also missed that after opening the bottle, you have to put it into the fridge. And now I realized this morning that it became a little bit blurry, and so. You also should read it very carefully if you want to use this kind of natural herbs, natural ingredients. Let's move a little bit away from all these things which you can swallow. Maybe we can go to the point. We have one question about the exercising. So one of our followers asked if it is good to exercise, because probably when you over exercise, then you also have probably the possibility that your immune system will be weaker afterwards.
Exactly. So we need from a lot of athletes, so when they have a severe training, the immune system is really suppressed. So, and they are at risk, at far higher risk to get a viral infection. So at this time, at the moment, I would not recommend severe hard training. So, for example, I would not prepare myself for a marathon run. So I think it's more important to have a moderate, intense cardio training every day or every other day. And I would also recommend to do it outside. So we know if you compare a run on a treadmill with a run system, and we have far lower cortisol levels afterwards. So and I think it's far better to spend outside with fresh air with a moderate intense run, so slightly increased heart rate. I think in your age or my age, 120, 130, for example.
Okay, and how long would you say is healthy? Half an hour or
half an hour, 1 hour? Well, you feel perfect with the sport, so you should not do too much. When you feel absolutely destroyed afterwards, you know that this was too much. So do a fun walk or run.
Mm-hmm. We had a lot of questions concerning stress. That stress also harms the immune system. Is this something you can say that this is true, or do you have a meaning on this?
Well, absolutely, quite clear. So we know, especially chronic stress, results in a severe increase in cortisol levels in the body. And we know for a long time that cortisol suppress immune reactions. And of course, with the chronic stress, you are on a far higher risk on a viral infection, a bacterial infection. Maybe you know it from when you learn for exam or whatever. You feel well until you've passed the exam, because then you have high adrenaline, noradrenaline. But afterwards, you have a severe drop in these hormones and increase in cortisol, and that is the reason why after the exam you get an infection.
Mm-hmm. Okay, so you should try to reduce stress, and I think sometimes also when you look too much on the media about all the things which happen in the world right now, I
Absolutely.
think there will be also get kind of stress. You will be creating kind of fear, and probably it's also good to, I wouldn't say avoid this kind of news, but not probably spending the whole day with it. Maybe just concentrated on 1 hour, and then trying to focus on a little bit more positive things in your
Absolutely.
life.
Absolutely, I absolutely agree. So I think we can change today's situation with coronavirus in the whole population. So I think at the moment is to concentrate, to stay healthy, to wash your hands, to wear the masks and so on, and to avoid too crowded areas like in the public transportation or in bars or whatever, if they are open. So I think that's important to concentrate, to stay healthy, and then don't care about the rest, and don't read all the news about that in the newspaper or in the iPhone.
So drinking enough is always beneficial, but I could imagine, so normally when we say you have to drink at least 2 liters or something like that per day, we are always speaking about water, but probably water is it's not bad for your immune system, but probably it is not something which boosts your immune system. Are there any other things? I could imagine when we're drinking 2 liters of orange juice, we are getting for sure a lot of vitamin C, but also a lot of sugar.
But you also get obese.
Is there anything where you say, okay, this is something you should drink and is on the other side good for immune system?
Well, I think water is not so bad as you mentioned it.
No, I didn't say bad. I said neutral.
Because we are, most of us, especially if you have a look on our clients here in the Lanserhof Tegernsee, most of our clients, when they arrive, they are dehydrated. So, and they are severely dehydrated. So they need 3 days, some of them, to become normal hydration levels. So, and that's really, so water, I think, should be the basic of hydration. And then, of course, there are some drinks which are maybe more healthy. I think it's not a good idea to drink a lot of juices. Well, we both knew that juices consist of a lot of sugar, and it's a problem of our obesity pandemic at the moment. So I think it's far better to have supplements and fresh fruits and vegetables. But tea, for example, may be a good idea, and especially the green tea, because the green tea has it's packed with flavonoids, with antioxidants and so on. So, and especially it's far more antioxidants inside than if you compare it to the black tea, because the black tea, it's fermented, and most of the healthy ingredients are gone away in the black tea. So that's the reason why I think at the moment it may be a good idea to drink green tea. Because
so I'm having a matcha tea every morning. This is good.
Maybe a good idea. Yeah, absolutely, absolutely.
Okay. We have some questions in between here on our feed. One question was elderberry. To be honest, I don't know elderberry. Do you know what elderberry is?
Unfortunately, not.
We will find
So,
out, and hopefully can help give you the answer later. The second question was, what do we think about the situation in Brazil where the president is against the isolation? Do you have a meaning on this?
well, at the moment, we can't say what is correct or what is not correct. So, especially if you have a look on Sweden, that they have not a strict. Do you mean the lockdown of the whole population, or do you mean the isolation of infected patients? What are you talking
The
about?
isolation of the population. So in general, not the infected
Yeah.
ones.
So the infected ones, of course, they have to be isolated, and also we have to protect the patient at risk, which is the older ones, and the patient in the hospitals. So the hospitals and the senior flats, they have to be closed, of course. But the question is whether it's better to be aggressive or not. And at the moment, we can't answer the question because Sweden, for example, they are not so aggressive. They have still opened their actual restaurants. They still even have to open for a long time the resorts just for skiing, and they just protect the patient at risk, and they just forbid meetings. I think the level is 50 individuals. So and they do have a little bit higher death rate, but they also have a higher infection in the whole population. Maybe they get earlier prevented by immunity of the population, but I think even both concepts, to be strict or not strict, have the problem that when we wait until the whole population is immunized on natural way, that will take a long time and will result in a lot of death. So I think at the moment, I think both ways are okay, and let's see who's a better one at the end for the next viral infection.
Okay, maybe we should, at the end, it's a kind of political thing, so probably we should stay to the really health-related ones. So we now get the answer. It was just a typo. It was not edelberry, it was elderberry or elderflower, so Holunder. So the question was about the benefit of Holunder, which is for sure pretty good because it also have a lot of antioxidants and vitamin C. So and I know it from my childhood. To be honest, we had a lot of elderberry juice. We drink it especially in the winter season with some hot water and some sugar, and it was very tasty. So probably not the right temperature anymore, but.
Yeah, it also boosts the immune system. It's known for that since centuries. And I think the variety of different foodstuffs, that's important. Never concentrate on one thing. Because if you eat only one specific thing, what you believe is healthy, you will for sure have an overdose on the one side and a lack on the other side. So I think the combination, the variety, that's what's important.
Okay. I had another question I noted here was golden milk. Golden milk is at the end curcuma turmeric milk. So when I'm in London, I'm having it all the time, and I haven't found any possibility in Germany to drink golden milk, to be honest. But like Dr. Stritzke has already mentioned, that turmeric has a very positive effect, so I think drinking golden milk is for sure good. Having too much golden milk, you will again have a lot of calories. So, as far as I know, there's no negative effect in heating up turmeric. So you will still have the benefits out of it. Coming back to the drinking part, now let's talk about alcohol.
My favorite cup, yes.
I have learned already, so in all the statistics in the world showing that the consumption of alcohol at home is going up at the moment, which from my point of view is quite interesting because everybody is afraid to get the virus and try to boost the immune system. I'm pretty sure that alcohol, let's say, have an effect on the immune system, but probably not a positive one.
Exactly. So we know for long term that alcohol, even in a small consumption, reduce the immune system. Especially there are specific cells, the dendritic cells, which are important for the presentation of the pieces of viruses to the immune system. And especially this part is really important to start the immune reaction. And you block this reaction with alcohol. So that is for sure not really a good idea. And we know it also for a long time that if you drink too much alcohol, that also the efficacy of vaccination is severely reduced. So for sure, drinking too much alcohol at the moment is really not a good idea, because this will suppress your immune system. Yeah.
I had another question which really surprised me, if tobacco is bad for the immune system. So at the moment we are talking about a lung disease, and I think smoking at all is probably a bad idea, but please give an answer from a medical point of view.
Well, especially in this kind of virus, in the coronavirus, it's especially known that tobacco use is really bad. And the reason for that is simple, because the coronavirus needs a specific receptor on the cells, which is called the ACE receptor. So, and this receptor is upregulated in the smokers. And that means it is far easier for the virus to get into the cells in the smokers because of the high amount of the receptors on the cells. So, and that's the reason for it's without a question, smoking is always bad, but especially nowadays, it's really bad.
Thank you very much. We had a lot of questions about sleep, and a lot of people mentioned that they are sleeping pretty bad at the moment. So sleep is infecting the immune system, I guess.
Absolutely, we know it, of course. So a good sleep, and also a good quality sleep, and also a sufficient sleep is really, really important to boost and to stimulate your immune system. So, and especially at this time, it's important and if you spend a lot of time in the home office, for example, you may have problem to have a regular life. Yeah, because when you go to work, well, you have to get up always at the same time, but in the home office, sometimes it's not needed to be up at the same time. So what I would suggest to continue with normal life, and also at the weekends, so that there's not a big shift between the weekend and the normal life. Because if you go to bed much later at the weekend than in normal life, so we have something what we call a social jet lag. And well, this is stress for the whole system. So try to get to bed at the same time point, not too bad, so that you have 7 to 8 hours of sleep, and get up without an alarm clock, so that you get up relaxed. And then if you have problems to fall asleep, it might be a good idea to stop drinking coffee too late. So because we know that during the day, we increase the need to sleep. So that goes upwards. And if you have enough sleep power, you fall asleep easily. But if you drink coffee in between or too late, then the increase over the day will be lower. And that's the reason why it's maybe not good to drink coffee after 12 or 1 p.m. So yes, and
we had one question here in the feed right now concerning meditation.
Perfect.
I think also it's we had it on our German podcast, the effect of meditation, so that helps you a lot to improve even the quality of your sleep.
Absolutely. Quite not only for the sleep, also you can, because meditation results in a drop in heart rate, you get more relaxed, blood pressure goes down, stress level goes down, stress hormones goes down. So you can, of course, meditation or some other therapies like breathing therapy or whatever, if you're not familiar with meditation, you can also try this. So everything what keeps you relaxed and lowers the stress level, of course, will help with the immune system, and of course will help also with better sleep.
There's a comment from Dr. Ursula that smokers increases also the stress in the body, so not relaxing. So this is, like we said already, stress is bad. Stress is bad for the immune system. So thank you for the comment, Ursula. Let's come to one point. I'm pretty sure it must come from someone in Germany because this is so typical. This is so typical thing to improve your immune system. You should have alternating showers or food baths. So because so following Dr. Kneip, which is from Germany,
I don't know whether Kneip therapy.
If it is so common everywhere in the world, but does it really work?
Yes, of course. So not, but so if you have alternating showers or just cold showers, or if you spend outside when the weather is not good, we know that this boosts the immune system. But you have to be careful to start too aggressive. For example, if you have holidays on my small island called Sylt, which is in the far north of Germany, and we have a lot of storm and wind, and if you spend at the first day the whole day outside, you will get a flu immediately. So that means with all these stimuluses, you have to be careful. So start slowly and also, well, do it consequently, but start with half an hour outside with cold weather, and then we spend more time outside, and also start with the showers slowly. Start, for example, with the feet. At the first day.
I really must say I'm used to shower cold, but my experience on your island is that you have the coldest shower water in the world. I don't know. You have done something with the physics on Sylt, so that in every other part of the world it must be frozen, but in your case it is still liquid. It is really, really cold, the water on Sylt.
That's absolutely true, but I like that.
Okay. Haya, you asked for the vitamin D. We had this question already. So after this live session, you can maybe have a look because we just talked about it very early on the session, so you can see it afterwards. We had just 3 more questions. Why does air humidity also play an important role? I can't answer this.
You can answer that?
No, I can't. Please? I can't.
So you can't then. Oh, okay. So that once again, it's something with hydration level. So if you're dehydrated, you lose also a lot of humidity or water with breathing. And if the hydration in the room is low, then you lose even more. And so that is, on the one hand, this is a problem. On the other hand, also the tissue inside the lungs become dried. And that means that the blockage for the viruses is reduced. And that's the reason why you get a higher risk on infections if you are in a too dry room, or if the humidity in the room is too low.
Okay, sounds good.
Maybe you feel it also when you're in the winter. Then you get also some bleeding problems in the nose sometimes when the humidity is too low.
Mm-hmm. We have here a question from Alvenza. Can you comment on post-pandemic stress syndromes?
Well, I can't. So, well, to be honest, I'm a cardiologist, but I'm sure that like after a war or after terrorism, we will have that. So because well, I'm lucky. So because I'm living in a hotel with a lot of forest around me, so can spend a lot of time outside. But keep in mind, there are also others on the lower social level spending with the whole family in a small flat. The childs are crying and you can't go outside because you're not allowed to do so. So, and of course, for sure, this will result in such post-corona, post-pandemic stress reactions.
So Ursula said she can also answer this. So Ursula, I think we really have to make the next session also with you. Let's see whether this is technically possible or we make an extra session. My last question. Oh, there was one missing on the comments here right now about Manuka honey. So my wife is a big fan of Manuka Honey. I don't know if she just likes the little candies, or if it really makes sense. Do you have an opinion on this?
I don't know what Manuka Honey is.
Okay. Oh, it seems to be that it have a kind of antibiotic effect in a way, but I don't know if it is really proven. But we have to.
Well, I know that some honeys have an antibacterial effect, so I'm not sure whether they are also effective in viruses. So sorry, I can't, this question I can't answer because I'm not an expert in that.
I'm not that sure whether you are an expert on the last questions, but it comes to the importance of social contacts. So we had also a podcast in Germany with one of our experts on this, but maybe you also have an opinion on this.
Well, quite clear. We know we are social human beings, and we need contacts. So, and also in our clinic, so we have new restrictions so that we have to take 1.5 meters distance. We are not allowed to give us get someone in your arms or whatever. So, and this is also for the climate in this working field here is really hard because we want to be more in touch with others, and we want to talk to them and have fun with them, drink a beer with them. And I feel it on my own. I'm also sometimes really start to become depressed because I need social contacts. And of course, depression is a problem with the immune system. Yeah? We know if you get depressed, immune system goes down and immunity goes down, and you're at higher risk of getting infections.
I personally can say that I'm currently seeing my friends more often than I have seen them before the virus, but only on house party and video conferences and so on. But normally on a regular, I don't know, Tuesday, I'm normally traveling, and then I'm not used to make a house party at the end of the day. But nevertheless, I'm seeing them more now, but it's still not the same. It's also good to, I don't know, give your friends a hug and see them really close.
Well, of course, this may be a not so good alternative, but well, I could not imagine what would have happened 10 years earlier when we don't have all the techniques to communicate, to have video chats and so on. So, well, if we have Corona, let's have it now, because now we can communicate.
Here's another question. What smallest change can we make in our daily lives to affect the biggest benefits?
Sorry, what daily change?
No, what smallest change can we make in our daily lives to affect the biggest benefits?
Well, this is, I think, sleep, for example, to improve and to avoid bad sleep. I think it's easier than one might expect. So just by controlling the time when you go to bed and you get up, then healthy food is also, I think it's not so hard to change from processed food to healthy food, and to spend some time outside, to be active. It's always the same. It's sleep, it's activity, it's healthy food.
Yeah, but I also think that maybe this person wasn't on this session when you mentioned it. But I really like your advice that we still should have a regular life also when we are in the home office, so that we stand up early in the morning, that we taking a shower, that we dressing up, that we are not working in the bedrooms, that we have a defined working space and only work at the space within the office hours, and not mixing up your leisure time with your office time. I think this is quite important. This is just a very small rule, which for sure have a very good benefit also for your mind.
Yeah, and at this time, I would also take some supplements regularly, without measuring the levels in the blood. So at the moment, most of the time, which you already mentioned, you can't overdose most of the supplements. And so just keep in mind B vitamin, C vitamin, D vitamin, and maybe zinc.
Excellent. I think having a good mood is at the end also very beneficial. So I hope that we brought you in a way in a good mood. We don't want to make so much fear out of this virus, and hope that you find it helpful. Jan, thank you very much for your time. I know it is, especially for you at the moment, quite challenging because you're getting a lot of requests and a lot of new kind of diseases also in a way. So great that you took the time for us, and we will see us again next Wednesday at the same time with a new topic.
Perfect. It was a pleasure to be here.
Thank you.
Bye-bye.
Bye.